Modern life can make our lives easier, but that isn't always a good thing.
There are only two phases in life. There's a phase of growth and development, a turning point, and then it's downhill all the way. When that turning point takes place is determined by social factors. For most people, it's the early 20s, when they get their first sitting job. Because the modern environment has three great dangers: the car, the computer, and the desk job.
We're moving less than we did, and it's affecting our education, health, communities, and happiness. Inactivity is a ticking time bomb for the health of the next generation.
We have a responsibility. We know now that the population of children are getting bigger, and that obesity and children being overweight is an increasing problem. And I think therefore we have a moral duty actually to do something to address that, bearing in mind the amount of time that children spend in school.
You might not want to hear it, but modern life is negatively affecting our physical health.
The health benefits of being physically active are both physical and also mental. So in terms of physically, you can reduce your risk of diabetes, of cancer, of heart disease, and actually you can really help prolong your life.
And while modern life is negatively impacting our physical health, being inactive can also damage our mental health.
At Oxfordshire Mind, we're passionate about people being physically active. And the reason why we're passionate about that is because we know that if you have good physical health, you have good mental health. And vice versa, the two are inextricably linked.
In fact, inactivity kills as many people globally as smoking. But we can all take decisions that make active lives possible. We must change our behaviour and give children an active start in life.
Every head teacher wants their children to do as well as they can with their learning. And I still believe that physical activity and kinesthetic learning is a really powerful way to engage children in learning.
We should be proactive and embrace physical activity as a powerful solution to prevent and treat over 20 major conditions and diseases.
If we had a pill that you could take that could do all these amazing things, I think most people would want to snap it up. But yet it's still quite incredible that 1 in 5 people aren't doing that.
Physical activity can have a profoundly positive impact on mental health.
But for a wide swathe of the population, physical activity, eating well and sleeping well is like a magic drug.
It's vital that we shape healthy places so that we can enable active lives and bring communities together where we live, work and play.
We're here in Bicester, standing along the blue lines. It's a great place to be, and what it does is it encourages people to get out and about, walk, cycle, run, whatever they want to do, or socialise, bump into people along the route, and it's a really good way of getting people out and getting more active.
And we must change our culture to see movement as vital for everyone, helping us to connect with others and adding healthy years to Oxfordshire lives.
How fast you go downhill is not determined by ageing, but by loss of fitness. And a gap opens up between the best possible rate of decline and the actual rate of decline, a gap called the fitness gap. But for most people, the problem is that the fitness gap gets wider faster after the onset of disease, because everyone thinks, including many members of the medical profession, that when you've got long-term conditions, you should rest. Take it easy. We don't like to see older people struggling. Younger people struggle, it's called training in gyms. So what's emerging very clearly now from the science is that we can prevent or delay dementia, frailty, and the need for social care. But what we have to do is to change to get people more active. More active physically, more active cognitively, doing things with their brain, and more active emotionally, doing things with other people. And if we do these things, then people will feel better, think better, be fitter, and they'll live longer better.
We know that fighting inactivity and getting Oxfordshire residents moving can help tackle and prevent many of the challenges in modern life. But we can't do any of this alone. We're fighting inactivity in Oxfordshire. What can you do to help?